Bismillahirrahmanirrahim. Okay, number one, the Baldrige Healthcare criteria for performance excellence establish standards for A, corporate compliance, B, excuse me, a certification, C, an accreditation, D, an award. What's the answer for this? Yes?
It's an award. Yesterday we have seen as a sidebar.
I have mentioned this one yesterday, the Baldrige Healthcare criteria.
Yeah, it is an award.
It is an award. Very good. Yes. These are framework used to evaluate and recognize the organizations that demonstrate the outstanding performance in healthcare. Okay, these criteria set the standards for organization aspiring to win the Malcolm Baldrige National Quality Award, which recognizes excellence in various sectors, including healthcare. Okay, it is not letter A. This is incorrect because corporate compliance refers to adherence to laws, regulations, and ethical standards in operation, while the Baldrige criteria focusing on performance excellence rather than the compliance issues. It is not a certification because the criteria do not lead to a certification like the ISO or other compliance-related certifications, as well as it is not an accreditation as well. So the answer is letter D. For number two, critical data selection, elements for focused review of appendectomy surgeon. A, appropriateness, admitting symptoms, and pathology result. Letter B, admitting diagnosis, pathology results, and committee review. C, preoperative testing, surgeon, admitting diagnosis, and age. D, LOS or length of stay, diagnosis on admission, age, and surgeon. What's the best answer? Okay, the correct answer is letter B. It is a review selected cases to confirm non-compliance with the criteria. I'm sorry. Okay, what's the answer here?
As a clinician,
I think diagnosis, pathology, certain committee review.
Yes.
Yeah, it is when it is a focused review. So it depends upon what exactly the admitting diagnosis and after the post-operatively what the pathology result. So this will be reviewed in the focus review. So the committee is the B, answer the B.
Okay. Do you have any idea, Radha?
I go with the same elements for focus review.
For the focus review of what?
Second.
The second. What's your rationale for this?
The data collection depends on all these diagnosis, pathology result, and committee review.
Okay.
Symptoms usually don't collect the data. Then surgeon don't collect the data. Which surgeon? Then diagnosis on admission, age, and all is not the criteria.
Okay, you have the idea. Okay, hold on for a minute. Just want to drink water. Hold on. Okay. This question is asked about the key data elements that should be selected for a focus review of an appendectomy surgeon performance. So each choice includes a combination of factors like symptoms, diagnosis, okay, the pathology results, and other clinical information. So what's your answer, Dr. Gulam?
Actually, it is the admitting diagnosis. basing on that, if the surgeon performs the procedure, the pathology result should confirm the admitting diagnosis. So this is reviewed in the focus data.
Okay, because the correct answer here is letter B.
Yeah.
This option includes the critical elements. We have the admitting diagnosis, the pathology results, and committee review. This option includes all the critical elements for reviewing an appendectomy surgeon's performance, such as diagnosis upon admission, pathology results, which confirm the surgical findings, and the committee review, which adds a peer evaluation aspect to the process. Okay, so the answer is letter B. Okay, number 3, which of the following issues might be most important to hospitals negotiating contracts with health plans? Letter A, MCO accreditation, bylaws, medical staff practitioner credentialing requirements. B, staffing, reimbursement, and confidentiality of peer review information. Letter C, computer capabilities, the MCO accreditation review requirements. And B, data requirements, confidentiality of peer review information, and reimbursement. What's the correct answer? Okay, it's letter B. When we say data requirements, health plans need hospitals to provide specific data for claims, quality reporting, and utilization reviews, which is it is a critical, one of the critical component of the health plans. While the confidentiality of peer review, this is a protecting, or it's a protecting sensitive data that ensures the legal and quality compliance for hospitals, while reimbursement is what we call the payment terms, are the most critical or important financial element of contract negotiations. Why not letter A and B, C? Because for A, this focuses on the operational compliance, not contract priorities. For letter B, staffing is internal, but it is not a contract issue. While for letter C, computer capabilities are secondary to financial and legal concerns. So the best answer is data requirements, which is letter D. For number 4, the practical motivation for American Health Plan, HMO, to develop a disease management system based on practice guidelines and clinical path is A, capitation, B, healthcare reform, C, collection of HEDIS data for NCQA, and D, its mission as a health maintenance organization. What's the answer? Any guess?
I think it's motivation means it's a capitation.
Okay, what? Okay, yes. The best answer here is capitation. For the capitation, physicians are responsible for analyzing and confirming the variations in
guidelines.
Okay. Yes, for the guidelines, practice guidelines in the clinical path, which is the capitation. So for why not letter B and C, D? These are all these are all not relevant to the A, capitation, which is having it deals with the practice guidelines and in the clinical path. Okay, so the letter A is the answer here. Okay, for number 5, negligence means lack of proper care. In medical malpractice, proper care is determined by A, Joint Commission standards, B, jury of civilian peers, C, tort law, D, medical peers. What's the answer here? Negligence.
Negligence.
Medical practice, proper care, it is determined by who?
Medical peers.
Yes, very good. It's the medical peers. In medical malpractice, proper care is based on the standard of care. So it is determined by the medical peers. Why not the JCI standard? Because this focus on
They
the
have
hospital
extra standards.
accreditation, not the negligence.
Yeah,
About the
the-
jury of civilian peers, this decides the case but relies on medical expert testimony, while the tort law provides the legal framework but doesn't define the proper care. Okay, that letter D is the correct answer. Number 6, a physician or licensed independent practitioner. The QM function is a researching criteria. Options for specialty-specific peer review. B, determination of what constitutes a deviation from an accepted standard of care. C, determination of data collection methodology for non-physician clinical reviews. D, tabulation of peer review data for periodic committee reporting. What is the correct answer here? Okay, the
B.
correct is very good. Letter B. Okay, a key of quality management function for physicians or licensed independent practitioners, or the LIP, is to assess care and identify if it deviates from the established standards, ensuring equality, improvement, and patient safety. For letter A, researching criteria is preparatory work, not a core of QM function. For letter C, data collection methodology is an administrative task, not specific to physicians. While letter D, tabulating data is reporting functions, not directly related to determining care standards. Okay, so the answer is letter B. Okay, moving on. Number 7, of the following options, conclusions concerning a licensed independent practitioner's care drawn from organizational quality performance improvement activities would most likely be used during A, case management, B, re-privileging, C, productivity management, D, initial credentialing.
A, licensed independent practitioners.
Okay, the answer is
Re-
privileging.
Re-
Why? Conclusions from quality and performance improvement activities are typically used during re-privileging to assess whether a licensed independent practitioner should continue to hold specific clinical privileges. This process ensures the ongoing competency and adherence to quality standards. Case management is wrong because it focuses on patient care coordination, not practitioner performance. While for letter C, this involves measuring the work output, not clinical quality or privilege assessments. And letter D, this relates to the first evaluation of qualifications, not the ongoing performance. Privileging ensures the continued quality and safety of care provided by the practitioners. Okay, the answer is privileging. Number 8, a trend has developed over the past year indicating that an internal medicine physician has significant difficulty treating patients with out of control diabetes who are admitted for inpatient care. Peer review of cases, along with meetings with the physician, has continued for 10 months. Which of the following is now the best action option to correct this performance problem? A, a letter from the department chair or medical director. B, a medical education program about diabetic management. C, required consultation for all diabetic patients. And D, summary suspension of admitting privileges. What's the best answer?
Internal medicine is a broad specialty.
Mhm.
And when the physician has a problem with control, diabetes is out of control for past about more than 10 months. I
Yes.
think all the cases should be referred to the diabetic consultant.
Okay. So what is your answer then, Doc?
C.
Letter C?
Yeah.
Very good. The answer is letter C, required consultation for all diabetic patients. If a physician, just to add to your answer, has ongoing difficulty managing specific patient cases despite peer review and meetings requiring consultations with a specialist ensures patients receive the appropriate care while supporting the physician's learning and performance improvement. For letter a letter is insufficient as the issue has persisted for 10 months. For letter B, a medical education program, education alone may not immediately address the critical performance issues. While for letter D, this is a severe measure typically reserved for immediate threats to patient safety.
Actually, if you see, it is a structural process where we have a family physician refer the cases to the internal medicine, and internal medicine will, depending upon the severity of the patient, refer to subspecialties. So this comes in the tertiary care. So when we see that this internal medicine physician is unable to maintain the patient, then she should be referred to the subspecialty. So this is the reason behind this question.
Yes, very good. Thank you for that, Doc. Okay. For number 9, which of the following is not a requirement for an organization-wide quality management program? Okay. Letter A, quality management activities include the use of performance measure in peer review activities. B, peer review problems are resolved and opportunities for improvement are taken. B, the effectiveness of the program, including peer review, is evaluated. What's the answer? Okay, the answer is letter C. Reports to the governing
Reports
body.
to the governing body includes the findings of peer review activities.
Okay. While reporting findings to the governing body is a common practice, it is not explicitly required component of an organization-wide quality management program. QM programs focusing on the improvement of care quality, resolving peer review issues, and evaluating program effectiveness rather than mandating reporting to the governing body. For letter A, this is wrong. This may not be mandated but can be part of the quality activities. Well, for letter B, resolving issues is a fundamental requirement for QM programs. D, evaluating the program effectiveness ensures the continuous improvement, whereas it is the core quality management program goal. So the answer here is C. The incorrect
This is the wrong answer, actually.
Reports
Basically,
to the governing body.
This is the wrong answer. Huh?
Yes, this is the wrong
Wrong
answer. Okay. Okay, we'll move on. Okay. Number 11. Oh, number 10. I'm sorry. Are we done? No, not yet. Okay. Number 10, I'm sorry about this one. Okay, for number 10, an orthopedic surgeon in a surgical group refuses to accept his post-operative site infection data and high rate for joint cases over the last year. What could the QM professional try next to convince him? A, present the data to all the orthopedic surgeons using practitioner names. B, do nothing with the surgeon and continue to measure. C, have peers outside the group review all the surgeon's cases. And D, with the medical director, show the surgeon the data compared to peers. What's the answer?
C.
Okay. What about you, doctor?
It is D, because
D.
this is when he is denying this infection rate for the last 1 year. 1 year is a major period. And
Yes.
I think it should be good.
Very good. Okay, this is X. Letter D is the correct answer. To address the surgeon's refusal to accept the data, comparing their performance to peers provides the context and highlights deviations from the norms, from the normal, involving the medical director, ensuring the authority and collaboration, thus increasing the likelihood of the surgeon's acceptance and engagement. For letter A, presenting data with practitioner names could cause defensiveness or conflict within the group. For letter B, doing nothing and continuing to measure does not address the issue or lead to improvement. While for letter C, having external peers review cases is excessive and may not be necessary at this stage. For 11, when the surgeons at Sunrise Ambulatory Surgery Center determine that action must be taken to resolve scheduling problems in the OR, the first task should be to A, write letter to each surgeon involved, B, form a team of interested surgeons, C, refer the issue to administration, D, refer the issue to an interdisciplinary QI team. The first task
Resolving
should be to, the answer is letter D. Refer
D.
the issue to an interdisciplinary QI team.
Interdisciplinary.
This is the best suited to address scheduling problems in the operating room. These teams bring together individuals with diverse perspectives, including clinical and administrative staff, to identify the root causes and implement the effective solutions. For letter A, writing letters does not address the problem collaboratively or systematically. For letter B, forming a team of surgeons alone lack the interdisciplinary perspective needed to tackle scheduling issues effectively. For C, referring to admin bypasses the collaborative approach that a quality improvement team provides. So the answer here is refer the issue to an interdisciplinary QI team. For number 12, the Wellness Medical and Health Center uses a multi-level medical record review system to monitor clinical care that cannot be evaluated through their electronic data systems. Nurses, other clinical staff, health information management staff, and physicians participate. Physicians usually do all except, meaning the wrong answer. A review confirm variations in trend data. B, review selected cases to confirm non-compliance with criteria. C, provide oversight monitoring of non-physician clinical reviewers. And D, screen cases for peer review. So what's the best answer?
D.
B?
D. D. D.
D. Dog? Is it dog? Letter D, dog? Radha?
D, dog, huh?
Yes, very good. The answer is letter D, screen cases for peer review. This is the wrong answer. Physicians generally do not screen cases for peer review, as this is typically done by other staff, such as nurses or health information management personnel, who identify cases that require further review based on predefined criteria. For letter A, physicians review and confirm variations in trend data to ensure the quality care. For letter B, they review the selected cases to determine compliance with the care standards. While letter C is physicians provide the oversight, okay, for non-physician clinical reviewers to ensure the accuracy and the appropriateness. So these three are all correct except for letter D. Okay. So any question? That ends our cases.
Okay.
Okay, hold on.